I'm out here campaigning today because I really care about our NHS. I don't know if you've heard, but they're going to close the maternity services in Poole, and they're going to downgrade our A&E, so we're going to have to go to Bournemouth.
We're going to be losing our A&E in Poole Hospital, we're going to be losing our maternity unit, the community hospitals right across Dorset, in Alderney, in St Leonard's, they're being closed, and that's just the start of things. We're looking also at losing dementia care, services in adult mental health, as well as GP practices. So it's really important that the people of Poole know what's happening nationally and how this will affect us locally.
I've come out today to help campaign to save our hospital services because I'm really concerned about the funding cuts within our NHS and social care. What's happening across the country is we've got these sustainability and transformation plans, which basically mean a massive reduction in our hospital services and our care services.
Well, today, it's a nice day, it's dry, we're having a really good day because loads of people are signing up position, and even people who actually work in the hospital, they're signing up as well.
If you're living in Dorchester in future, if you're in a life-threatening situation, you're going to be having to go to Bournemouth. And Bournemouth is one of the most congested towns in the whole of the country. And so it's not acceptable to say that the changes that are occurring are anything to do with improving public health and your chances, because quite the opposite is going to happen.
I suddenly found, to my surprise, they're talking about a third of GP surgeries being closed.
The NHS is severely underfunded, and that needs to be addressed, as does social care of the elderly. That is not a new problem, the number of elderly. We have known for 70 years that the post-war baby boomers will reach old age.
The burden of the elderly. What a lot of people don't realise, that up in Scotland, the NHS is still there for people who are elderly. There are no charges if you move into residential care, whereas in England there's been a complete rundown of social and health care, and they're trying to dump the burden now onto the fact that the ageing population is to blame.
And the other plan is to move practices to hubs, remote hubs. Now, if that's what happens, it means that if you don't have local bus services, you're going to have to travel further to go and see your GP. And that's totally unacceptable, because people accept that the public transport around here isn't good enough. It's not fair to close down someone's local GP surgery and ask them to travel further to a hub.
It's all part of the process of running down and selling off the NHS, and unless we make a really loud noise about this, we will not the NHS will not see 80 years old.
The government, they've just had a vote on Brexit. They hadn't planned for what was going to happen if people had voted to leave. And this is their approach to everything these days. Nothing is really planned anymore. We have a housing crisis in this country. It's left to the free market, and that's exactly what they want to do to the NHS.
Also, the problems we got on the rail, the problems we got on in the prisons at the moment. Everything in the country seems to be falling apart.
They found the money for the bankers. They bailed out the banks, but the bankers still kept their bonuses. The same kind of political will there, it could be there, to properly fund the NHS.
I was born 2 days before the foundation of the National Health Service, and so that's quite significant to me, 2 days before, and I would like it to last beyond my lifetime. I'd like it there for future generations, free at the point of delivery. Don't wish to see it privatised, and I think the cuts that are being made, with all the changes being proposed, where is the evidence that it's going to save money?
I said what I'd like to do is really bring in the message from Keep Our NHS Public that we want a properly funded NHS, and that the NHS should be reinstated back to how it was before the Social Care Act came in.
And I think it's really important that people are made aware of this and that we fill in the public consultation forms, saying what our concerns are. We should write to our MPs asking them to support the NHS reinstatement bill, and it's vital that we connect up with all the other health campaigns across the country and come together on the 4th of March in London so that the government knows our strength of feeling.
I worked in the NHS and social care for 26 years, and I decided to get active.
So do support us at Keep Our NHS Public Dorset. Please look at our website, please join us and like us on Facebook, and come and join the campaign in the new year.